Hello everyone, you are all welcome to Alveoly E-learning. Alveoly E-learning is a non-governmental organization that supports the learning of students across the country. This tuition is purposely for Alveoly E-learning students and anyone interested in health education only, and should not be replaced with textbook or classroom tuition. During practical exams for health training students, such as registered general nursing, registered midwifery, and registered community nursing, students are required to do a nursing care plan for patients at the medical and surgical department. We have already done simple tutorials on the introduction to the nursing care plan in the previous videos, so kindly watch them if you haven't. We are going to begin with the first part series on how to write patient problems, strength, nursing diagnosis, objective outcome criteria, and nursing orders in a simple way as an Alveoly E-learning student. This is one of the easiest part of the care plan as an Alveoly E-learning student, so let's begin. Patient problems. Patient problems are supposed to be written in simple terms such as 1. Patient cannot bath without assistant. 2. Patient cannot perform oral care without assistant. 3. Patient has less education on condition. 4. Patient has wound on the abdomen. All the above are examples specific to certain patients. As the lesson unfolds, we will look more details into them. On the care plan sheet under patient problems, you will have 4 lines, and this indicates that you are supposed to fill the 4 lines with 4 patient problems. So try as much as possible to fill the 4 lines with 4 patient problems. Now let's have a look at patient strength. Patient strength is very simple to formulate based on the patient problems. Patient strength is 1. Anything that the patient can do or assist you the nurse one way or the other to help the two of you to achieve your goal. For instance, if a patient cannot bath without assistant and the patient can turn in bed to assist in bathing, it is strength for the patient. This is because it is not all patient who can turn in bed to assist you in bathing. Example, an unconscious patient cannot turn to assist in bathing. Hence, if a conscious but weak patient can turn in bed to assist in bathing, then it is a strength for that particular patient. 2. Anything that the patient has or possess that can help you to achieve your objectives or goal. For instance, if you have 2 unconscious patients, A and B, and as we all know, they all cannot feed. However, if patient A has a nasogastric tube, NG tube, in placement and patient B does not have a nasogastric tube, NG tube, in placement, then it implies that you can easily feed patient A through the nasogastric tube, NG tube. Hence the presence of nasogastric tube, NG tube, in placement, is a strength for patient A. Also, if a patient has wound and the wound is not discharging or not presenting signs of infected wound, then it means the wound will heal faster, hence, it is a strength for that patient. So we will be looking at several examples of patients' problems and strength in our subsequent videos, in order for you to get used to use specific patient problems with its corresponding strengths. Please let's note that on our care plan sheet, there are also 4 lines for patient strength, which indicates that you must provide 4 strength for the exact patient's problems that you wrote at patient's problems in an orderly form. This implies that patient problem 1 should correspond with strength 1 and same as the remaining 3. Watch out for more simple tuition in our next video on the careplan series tutorials. End of Chapter 1 of Formulation of Patient Problem, Strength and Nursing Diagnosis Made Easy for Practical Exams by Alveoly E-learning. Comments and ask your questions. Watch out for next chapter soon on Alveoly E-learning. Subscribe to our YouTube channel for more simple tutorials. Alveoly E-learning, bringing simple tuition to your doorsteps. Call or contact the course instructor on +2335 4955 6116 on WhatsApp for further tuition and explanation on any health tutorials. Don't forget to share, subscribe and comment on Alveoly E-learning YouTube channel. Thank you.